morning, everyone, and thank you for joining us. We are excited to have a lot of important people on with us this morning, specifically Representative Tana Sen and some folks across our North Olympic Peninsula that provide childcare services to working parents and families across Clallam County. So I'm going to allow our childcare community organizer, Dr. Lynn Keenan, to moderate our program today. So if you have any questions, Lynn will call on you. You can raise your hand or put your question in the chat and Lynn will call on you, and I'll let Lynn take it from here. Thanks, everyone.
Wow, thank you so much. This is so exciting as I see names come up who have joined the call. It looks like we have just a range of people from all the areas of childcare provision across our county, from family home care providers to center-based providers to out-of-school time providers and preschool providers. So I think this is a topic of great interest. Of course, we have a pretty vital childcare ecosystem in our county, and I think lots of people compassionate and passionate about serving the youngest people in our community. So this, I foresee an exciting conversation this morning. But I do want to acknowledge and introduce right away Representative Tana Sen, who anyone in childcare in Washington, and I suspect beyond, will recognize as one of the sponsors of the Fair Start for Kids Act, and who has been, I think, a tireless advocate for early education and early childcare. So what I'm kind of interested in doing is letting you take it away, Representative Sen, and then let me also introduce right away the people who are on, who are providing some out-of-school care, out-of-school time care here in the county, because we have a full representation of them. And we're really eager to learn how the Fair Start for Kids Act will have an impact on them and their work, as well as all those other folks. But if I may just introduce those folks too, because I know they're going to want to be chatting, and I know that other people on the call will be eager to hear them talk about how things have been going for them. But from the YMCA, we have Wendy Bart, the executive director there. From the Boys and Girls Club, we have Mary Budke. From our Shore Aquatic Center, we have Steve Burke. And who else did I see in that lineup?
Linda.
Is Linda
just coming on? We've been emailing her, resend her the link. So she should be joining us shortly.
So we may have Linda Middleton from, wow, all sorts of activities around the county, but especially Sunshine and Rainbows out in Forks. So when last we were all together, Representative Sen, it was before the passage of the act. And we were talking about that tension between parents who can't afford to pay more for childcare and childcare professionals who can't afford to make less. You know, we were understanding that on average across the state, parents were paying about as much as a parent might pay for in-state tuition for one child in childcare. But at the same time, the people who work in childcare in our state are making at about the 3rd percentile of our state range of income. So we were at that place where we had 0 degrees of freedom left. And I remember saying in one of our Coffee with Colleen's that these are big issues. They're not going to be fixed at a local level. And we have a ton of hope that this Fair Start for Kids Act would help to bring some degrees of freedom into that tense mix. And so really very happy to say that did pass. It was signed, and now it's making its way out to really address that. So I wonder if you could talk about whatever you would like about that. What
Sure.
inspired you? What inspired the legislature, et cetera? And then what can we expect?
Sure. Well, thanks for that context setting, Lynn, and thank you so much, Colleen, for inviting me this morning. It's great to be with you all. And I know I've been out in your community in person some, and that is really what inspired me, is the traveling around the state, meeting with childcare providers, family homes and centers and after-school programs and parents and school providers, providers of schools and early achievers, coaches and licensors, and really get kind of digging deep into what are the actual issues and what needs to be done to solve the childcare crisis. And I think, Lynn, just as you said, what we really saw and what's included in the Fair Start for Kids Act is it was not just a policy. It was not just a eliminate the copays. It wasn't just a increase the rate, the subsidy rate. It's a whole, and you use this word, ecosystem that we needed to support. And I think that's what's pretty fundamental about the Fair Start for Kids Act, is that it really took a look at a complex set of solutions to ensure that there was accessibility to childcare, then there was affordability for parents, and then there was the support for the workforce, because without any of that, there is no accessibility. And then also recognizing that in that 0 to 3 space, not everybody's going to childcare, but families and kiddos still need that some care in that 0 to 3 space. So what are we doing in that area as well? And in that workforce area, that's a very complex. It sounds like it's just a category, but there's a lot of things in there. So I'll kind of break it down a little bit in those 3 buckets, if you will, of accessibility and affordability, and then the 0 to 3 space. So again, I love how that you also talked, Lynn, that it's a state problem. It's not even, it's like a national problem. I think there's this national awakening that that is a broken market. It isn't something that childcare providers are not successful in their business because they can't make ends meet. And it's not that the state is doing something wrong or the community is doing something wrong. There's truly an imbalance, and it just doesn't pencil out these days. And so I think though Washington State is making huge strides in addressing that. And we tripled the amount of money that we're spending on childcare in Washington State with this year's budget, which is amazing. And so really the first step was to sustain childcare providers. And we did that through grants, and we have more rounds of grants coming out, and to really make sure that they can stay in the business. And the passage of the Fair Start for Kids Act for me was also critical as an indication, as an indicator that we have a long-term commitment to these investments in childcare. And so some of the legislators would ask, well, what if we just increased, do we really need the bill? And I'm like, first of all, there's high quality policy in the bill, but I'm like, there's no point if we do not show that we are long-term committed to childcare, then we are not going to get providers to go into the field. We're not going to get students to go into the profession, and it's not going to work. So we needed that long-term commitment. So what did we do? Well, first of all, on the copay factor. So for families, they, because of COVID, most copays were eliminated during COVID, which was critical to keep families afloat and anyone who could go to childcare to be able to afford it. And we're continuing making sure that no family pays more than $115 of a copay for the rest of this year. And then moving forward, and I don't have the exact dates, but keeping it still to no more than 7% of somebody's income, but generally keeping the lowest end either free or $15, $115, and capping out at about $250. versus that huge escalation, the benefits cliff, if you will, that sometimes families would have to pay, you know, $1,000. They're getting subsidized childcare, but they still had to pay $1,000, which meant they couldn't take a raise, they couldn't take more hours, they couldn't take a second job without a fear of not being able to afford childcare. So we're really bringing that that copay increase way down. So families should feel secure that they can afford childcare. So that was critical. We've also expanded eligibility for Working Connections childcare, and that's going to phase in over time. But just right out of the gate, more people will be able to access Working Connections childcare. I know that the Workforce Investment Act, the community college grants have been a huge positive for your community as well. And if you think about, if you qualified for a free college grant, then you pretty much have, or scaling it up, because it was, if you made a little bit more money, you had a lower subsidy for a community college. You can be confident that it will line up with childcare benefits as well. Because we want to say that, you know, if you know that you're going to get some college benefit, you're going to get some childcare benefit. And so that's just kind of a way, you know, it's not exactly one-to-one, but it's pretty much in that context to lay out for families that they'll be eligible for childcare. So that was kind of on the eligibility side, and really excited about that. And for ECAP, the state preschool program, we also increased eligibility to 50% we're moving to state median income, which again, I think all of you are pretty actually wonky because you're pretty in the weeds here. But we are moving away from federal poverty line and starting to use the state median income. And as you know, that like the national federal poverty line minimum wage, for instance, is $7.25, but in Washington it's $11.50. So it makes a lot more sense to use a state median income than a federal poverty line. It just means more people will qualify and more people will get that benefit. So for ECAP, we pushed out entitlement for ECAP, which was supposed to come online in the next couple years, but we added that all homeless youth and all tribal youth will be categorically eligible for ECAP come 2026, I believe. And so that is, that's really big. And then again, increasing the eligibility there. So ECAP is the state's preschool program. So it's a state paid for preschool program for 4 and 5-year-olds. Sorry, 3 and 4-year-olds. So that's the accessibility, affordability part. For accessibility, this is where we get to the market, right? It's fine if you can afford it, but if you can't find it, then there's no point. So we did a whole bunch of things, and I'll just run through quickly because I don't want to take up the whole meeting with the overview. But there was $50 million in the capital budget this year. Thank you, Representative Theringer, for early learning facilities funds to help build out childcare that people can apply for. So that's the capital side, including technical assistance for the smaller programs that maybe aren't used to being involved in construction. So that's a key part. But what we also did is we dramatically increased rates. So if you take Working Connections childcare rates, we increased that to the 85% subsidy rate, market rate. And that was huge. That was moving from 65% to 85%. And just for context, I know a colleague in Spokane said that he feels confident that he can give $1 an hour raise right off the bat to all his employees, just knowing about the 85% increase. We're also providing subsidy help for healthcare. So everybody who works in a licensed, I believe, childcare can qualify for healthcare assistance. So if you get your healthcare on the health benefit exchange, and there are designated staff people to help childcare providers do that, they'll pay $100 a month towards your premium. And so that is really important because we know that healthcare is a huge issue. We're providing shared business services. So if you don't want to deal with payroll and things like that, there's going to be hubs We're increasing infant rates, particularly. If you provide dual language, there's going to be extra rates for you if you provide dual language programs. If you have special trauma-informed services, there's a boosted rate. If you provide a specific equity program like a tribal ECAP or a, something where you're focusing on some sort of unique childcare curriculum or emphasis, then you can apply for an equity grant. So just childcare mental health consultation services. So this is one of my favorites. I know kids get kicked out of childcare 13 times more than they do out of K-12. And so much of that is around behavioral issues. So really providing consultation for childcare providers who might not know how to handle a child, and to really work with them to understand the behaviors and the trauma and things like that. So that's kind of in that whole, and professional development. So providing scholarships for providers to go into school, to have, whether it's a community college that you guys have locally, or if it's community-based programs or other components of that, is really critical. And so that's kind of that accessibility band. And then the last one, expanding play and learn groups, and like I said, infant care, and yes, thank you for the question around special needs. One of the other things I'm very excited, we created what's called a complex needs fund. And if you think about, if you're familiar with K-12 and you have special education dollars, and if you have a child who is above and beyond the regular costs of childcare of special needs, you can apply for like the safety net to get you extra reimbursement for special needs youth. We created that for both ECAP and for childcare, that if you are serving a youth with special needs, you can apply for extra dollars to get equipment or specific services for that child. We want to be able to have an inclusive environment for our youth with special needs, and recognize that that's going to be an extra burden or require extra services, probably staff, etc., for those childcare providers. So creating a special complex needs fund as well. So I'll stop there, because as you can see, I'll kind of forget things, and then somebody will ask a question and it'll spur a thought. But it really is comprehensive, again, looking at the whole ecosystem of childcare, from building it to offering it to affording it, and those early learning spaces. And one of the beauties, I think, of the bill too is, in its original introduction a couple years ago, it was really focused just on that 0 to 5 space. And through the great work of schools at Washington, of YMCAs and Boys and Girls Clubs and others, it really opened our eyes to the importance of childcare all the way up to 12, and really recognizing, and of course the pandemic showed that parents can't go to work if their 8-year-old has nothing to do, isn't at school. And that's just a critical developmental stages too. And we've got great programs that do great work in that space. So, so again, as I said, I'll stop there and take questions or have more conversation.
Great. Tana, one thing that I think that we all kind of wonder about, and maybe this is how a bill becomes a law question. Now that the act has been signed, what kind of time frame happens? And I know there are some time frames in the bill itself, but I guess that's the question of a hungry, thirsty.
Yeah, so the bill goes into effect July 1st. So some of the changes will take effect immediately in terms of the copay, the payments to providers, the copay reduction for families. Some of those other things, again, are going to affect July 1. The other things have a little bit more of a timeline, like some of the trauma-informed care grants or the dual language grants will take a year or two to set up. both kind of administratively and, the kind of the back end IT. The Department of Children, Youth and Families are hiring up quite a few people to help with this and with getting out the word. The other thing that the department is focusing on is there's $400 million in grants that are going out to childcare providers that came directly from the federal government. And that is going to apply to anybody who does childcare. So definitely Wendy and Mary and Steve, you guys would all qualify to again help sustain and build and really kind of have a really extra solid foundation for childcare providers. So there's a lot of work doing outreach on that. And one of the things that we did too is make sure that for those who in diverse communities who don't speak English as their first language, to make sure we have language access as a fundamental component of this. So really reaching out into the depths and as far as we can into, small childcare, family homes, outdoor preschools, outdoor childcare, to make sure everybody knows about those grants. So there will be quite an effort, but it will take, there are phases in the bill of when these are going into effect. The eligibility increases for families will be every couple years. So I think it's going up to 65% of the state median income right away, and then up to 75% in a couple years, and then up to 85% in a couple more years. So we can, again, we want to make sure there's enough capacity to be able to accept the demand. Oh, and one other thing, because I forgot to mention, also for student parents. So this was a huge thing for those at community colleges or getting their AA. You no longer have to do the work requirement for Working Connections childcare. So you can apply for Working Connections childcare, focus on your studies and your kids, and not have to have that extra work requirement as well. So that was huge.
Yeah. Colleen, did you have a question about the grants?
Yes, several actually. So
Great.
will all $400 million of grants be distributed through DCYF, and will they be will the funds just be allocated to the different childcare providers, or are there some kind of requirements? And from what I read in the American Rescue Plan, it talked about licensed childcare providers, but we have really critical providers in our county that aren't licensed. So will they be, is there some component within the grant system for them, and how will those amounts be determined?
Yeah, great questions. So it will be, it's not competitive. If you apply, you'll get it. I mean, if you qualify and you apply, you'll get it, but it's, you have to apply. So it's not going to just be sent out. I will quadruple check, but I do believe that very specifically in our legislation, we specifically said it includes, the after school programs, whether you're license exempt. I think you have to be license exempt at least. So either licensed or license exempt. So if you're not license exempt or licensed, then you don't qualify, but license exempt qualify as well. And I think they're figuring out, based on size and things like that, what the grant amounts will be. We did put some things into, so it's supposed to be around, COVID recovery. And so there are some federal requirements, like you're supposed to give a break to families. We put in that at least 10% of your grant has to go towards staff, because we want to make sure that, some of those benefits are going to staff, increased pay or a bonus or things like that. If somebody needs to get a vaccination, or if they're closed for a COVID outbreak or something like that, that to reimburse or to continue to pay your employees during that time. Or if that happened in the past, so you can use this money for if that happened in the past, you can, use some of those dollars to pay the staff who maybe had to, you guys were closed and you want to pay the staff for those few weeks since they lost that income. You can use it for physical capacity if you need to, put up barriers or, buy new things because of health reasons and things like that. So, they're going to be pretty sizable because the state has been giving out along the way, grants of, 6,500 for really small, and then, up to 30,000. So that was when we had about 40 or 50 million for the state to give out. And now we're talking $400 million. Like, this is going to be pretty significant. About 10% of that is for administration and language access and that sort of thing. But that's pretty significant.
Yeah, that's encouraging. Wow.
Hi, you guys. Hello.
Take it away. You have a question?
This is Linda Middleton, and I just want to say this is so exciting. So exciting. Thank you.
Thanks, Wendy.
Great. How about other bursts of excitement or questions for Representative Sen?
Steve has his hand raised.
I'm raising my hand. Thank you, Representative Sen, for being part of this and being such a leader in the childcare area at Olympia. Related to the bill that was passed, is there a document or a way to kind of sift through it to see what's applicable to license exempt versus licensed?
That is a great question. I think I can put that together. That's a great question. And so I don't know if that exists yet, but we will get that because I think that's a really great question. And there definitely are different components that were same with kind of early, like you had to qualify, you had to be part of early achievers or not. So I think like the mental health consultation, you had to be part of early achievers. And I think mainly on some of this stuff is because there's already not enough capacity. And so starting with the kind of the core, and then as it expands, let's expand it out. But definitely I'll get you that, Steve. It's a great question.
Yeah, just a example of the need here. We opened up our summer camp program signups yesterday, and we were filled with 50 before the end of the day and had to close it.
Wow. Yeah.
This is Linda Middleton again. We are overwhelmed. We've got so many kids and not enough capacity.
Yeah.
Mm-hmm.
Yeah, it's so interesting because, obviously we talk about it, and Jennifer from the hospital really came down and testified, and she was amazing, really just talking about the need. And, we hear it, but about, parents can't go back to work, we don't have childcare. And, we've all been in hybrid mode or at home with their, kids in school. And then this summer I was, for some reason, it didn't even really strike me so much that there's not even the hybrid. There's not even the, online. So they're not even distracted or organized distraction. It's just, so yeah, that's going to be really challenging. I do know that we did maintain some, for their ECAP providers, the summer ECAP. So for those, normally ECAP is only the school year, and we did extend it for summertime. So for anyone who is providing ECAP, there is some summer ECAP slots. But again, if that's not relevant, then that's pretty specific.
And along those lines, I know that on our call, we have some people who have some professional interest in growing their childcare businesses.
Great.
And then we're all kind of aware as a community, while we have this vital ecosystem, it's just not big enough. We still have somewhere between 350 and 450 slots that aren't available. So I imagine there is some energy around developing more childcare, and I know there is. Can you help those folks imagine what some of their steps might be?
Yeah.
In relation to the bill?
Yeah, I love that question. So there are a variety of components. So as part of the professional development, there is some of that money can be used for Imagine University, Imagine You, which is works with providers or potential providers who want to either expand or start a new childcare, to kind of create a mentorship program with an existing childcare to really help develop and support that. And that's more for family homes. So that is part and parcel. And so definitely reaching out to Imagine University if you're a family home or want to start a family home. We do have dollars in there that are going to Commerce to provide technical assistance to childcare providers who want to either get going or expand, to work with business to do that. And in addition, those dollars are really also targeted to like a business, like again, the hospital association, or if you have business want to come together to figure out how to do a cooperative, or how to build a childcare on site, or how to have more child-friendly policies at your business, there's some consultation there as well. And then of course the capital grants. So if you need that physical capacity, there's technical assistance as well as those dollars. So that's probably what I would point to the most.
Great. And those capital dollars will be coming through the Department of Commerce.
Correct.
Along with some of those other technical assistance services.
Exactly.
So there, we want to be keeping our eye on Department of Commerce offerings.
Yep. And I just remembered something too, back to Steve's question. One part of the bill that we have as well was that we recognized that DCYF has relationships with pretty much those that they pay, right? So if you pay a childcare, or if they're connected with a foster family, but they don't necessarily have connections just with parents and families, and they haven't really had a direct relationship per se to the after school programs either, because they haven't really, unless they were licensed or license exempt, where they were paying Working Connections childcare. And so we've created a work group to figure out how to build that, how to formalize the relationship with the after school programs in such a way that they can get out grants easily, that there is a email network and a communication network that is natural and ongoing. And so I'm really excited about that. And I know a lot of the schools at Washington groups are really excited about that, to really formalize that relationship, because I think that was a huge aha again during COVID, that we just didn't have a way to regularly or efficiently communicate with the license exempt and beyond programs. And so that is in the works as well.
Great. Along those same lines, what about your communications or DCYF's communications with parents? Because it sounds like there are going to be a lot more families who will be able to take care of, to be able to take advantage of subsidies. And how will they know that this could happen?
Yeah, just as so that's one of the big question marks, frankly, that I think we're really going to need to rely on this group. It sounds like Mary put in the chat, like a program like Prevention Works, getting the word out, hopefully schools being able to share that, employers, hi Jennifer, have employers share that with their employees, that there's expanded access. We are talking to some philanthropy to see if they can help with a campaign to really get the word out. Because again, the department doesn't really have relationships with just kind of quote unquote the public, or and so probably figuring out how, as a colleague legislator, I can put together some information that all my colleagues send out through their e-newsletters and things like that. But that's definitely one of the question marks. And I think some of the implementation dollars at the department has through the federal dollars and through Fair Start will be, again, to get the word out to providers, but to parents, that's really more of a kind of a marketing thing. And so hopefully we'll get some philanthropy interested in doing that. And but that's a great question. So it's going to take all of us.
Looks like Steve has his hand raised again.
Sorry, one last question. Related to the capital grants that Representative Theringer was so generous on, is there going to be some assistance? It can be very overwhelming for a small child care provider to navigate the public works types of rules that capital grants have to follow. And they could very well be overwhelmed very quickly without some help and assistance.
Yes, great question. So that was also one of the kind of during, this legislative session, we really focused on 4 main areas, right? COVID, economic recovery, racial equity, and climate change. And one of the components with racial equity in particular was kind of an awareness of how many communication streams, how many fundraising streams, how many programs and accesses really to kind of the mainstream, and that there's a lot of people who, again, who might not speak English, or certainly not English as their first language, or might not, read in a high level and understand wonk-ease and know exactly where to look or what to access. And so there's a lot of effort and awareness around that. And one of the major things was around this, to make sure that there's technical assistance and language assistance to reach out to providers and really do pre-planning work. So there's planning grants as well as capital grants. So if you know that you want to do a project and you have no idea how to do that, you can apply for a planning grant. And so that's obviously a much smaller grant, but to whether it's hire a consultant or an architect and have somebody help kind of hold your hand through the process to plan and then apply for a grant. So that was definitely a big component of that. And so if you have any interest or questions about that, just reaching out to the Department of Commerce, and I guarantee that is part of the process. And that's new.
So if I may add on to Steve's comment there, and in our county, by and large, except for residential building, the prevailing wage rates are the same in Clallam County as they are in King County, because the legislation in 2018 changed that instead of doing surveys, they say if there's a collective bargaining agreement, that rate applies for any occupation. And we don't have many union contractors or union employees that live in our county because we're fairly rural. But yet those collective bargaining agreements, somehow the geography incorporated Clallam County. And even though no one in Clallam County was part of that negotiation, nor were they represented by AGC or others. So if a business receives a small grant for a capital project, oftentimes we found that small amount can increase the cost of building by 3 to 4 times what it would have been had they not received the grant. So that is something that I think small businesses consider before they, get any state funding. We found several nonprofits that got, small state grants, capital funds, and then suddenly thinking that was, great and wonderful, but it didn't actually lower the price. Overall, it increased the price dramatically.
That's interesting. That's a good point. Well, the only thing I would say is in this time period, that might be an advantage, just given I understand the huge demand for both supplies and for the workforce right now. And so if you do have a project and you have to pay, or you are paying a little bit more, maybe that's going to be an advantage in this next year. But that's a really interesting context and in terms of the costs there.
Yeah.
I would also say that there is a regionalization on the market rate and what the subsidies are paid to for childcare providers. But I think that making sure that childcare providers, and this kind of gets to the prevention works comment too, that providers know that they are going to make a living wage might be a little bit too generous of what the subsidy rate increase will provide. But we're moving towards paying our providers, our childcare providers more. And again, the healthcare benefits and if they have that skill of trauma informed care, or if they have a dual language designation, or they can teach dual language, they can get more dollars. And so we're trying to definitely indicate that this is a career that people could go into and make a living, and again that they can get those scholarship dollars, and that they too themselves can qualify for Working Connections childcare while they're getting their degree or their certificate. And so we're trying to, at least on that front, make it more of a living wage and situation where people will go into that career. So that just spurred my thoughts on that too, Colleen.
So this is Linda Middleton again. I can't get insurance for the people that work for me. We do all kinds of social service programs besides childcare. But my latest quote would be $700 a month per person for insurance. Is this that you're talking about, is that only for people that can get into AppleCare?
Just for anyone on the health benefits exchange. And so it's not just the AppleCare, but if they apply on the health benefits exchange, then it would go towards those premiums. And there's a couple of staff who are now designated at the health benefits exchange to work with childcare providers in particular to help sign them up for healthcare. And so really working with them of what is the best option, working with you as an employer to figure out what's the best option for your employees around childcare. And so that, I think, is what people are imagining.
So I'm trying to figure out health insurance for all my people. And I'm pretty sure what they told me was that anybody I can't have anybody in any program on the health exchange. If it's a group insurance, they all have to be in the group. So it's so complicated to try to do stuff.
That does sound, you're probably more in the unique factor of having multiple employer sectors, but that's probably definitely not unique. I will explore that. I think your employees would still, or you would get, employees would still get $100 towards their health care. So while, 700 is not, it's 100 towards the 700 might not be, that's not going to make it affordable. That would still be a plus.
Mm-hmm.
So that would still apply to you.
Yeah, I don't think it's going to be much of a help. People really need health care.
Yeah, they do. Yeah, absolutely.
Yeah, and it sounds like there may be some assistance through this $400 million grant process.
Absolutely, you could use those dollars to help pay for the healthcare for sure. Yep.
It looks like maybe Jim Stauffer has a question.
Hi, Jim.
Hi, yes, thank you. Thank you for being here, Representative Sen. Hearing the conversation here, it brings to mind that we don't really value that child care worker. and it's part of the ongoing conversations in communities. A lot we hear on the Sequim side of the county is that we're just a retirement community, but we're so much more than that. And I think what has occurred so much this past year was that folks really saw the burden and what, and I don't know if burden is a good word, but I'll call it the ever increasing burden on American public schools. And I have this chart here in front of my room that talks about schools can't do it alone. And if we can work on the messaging of how much value those that our childcare centers, those workers, I like what you said about the career, the health benefits, and that's really what we need to work on throughout, and especially here, this area. You know, with my work across the state, I know those other conversation, but here specifically, we need these child care centers. We need, they need to know that they're valued in that work and how important it is. And they're not just the babysitter. They are providing care, critical care, safety care. And I don't think that's a clear message out there. So, but great conversations here. And I know I have another school board member from Port Angeles on here with me, and both of us work in that area. And at one time I was on Prevention Works. So I'll put another shout out for Prevention Works. They're a one-stop shop for things on child care services, and they have it going on. So thank you very much. And thank you for being here.
Thank you, Jim. I know for all you do for education across our state and in your community. And I think what you highlight too is that, you know, with the passage of Fair Start, the work's not done. And there's a lot of components in the bill. It really creates a Fair Start for Kids account and lays out a roadmap of where we want to go. And so there's a lot of components in the bill that didn't necessarily get funded, but said that if/when there are additional dollars for early learning for childcare that the state receives or the state generates or get the budget allocates, we know where we want to spend those dollars. So if we got more, we would do this. And if we got more, we would do this. And if we got more, we'd do that. And so definitely like on the healthcare field, you know, this was a step. This is the first time we had done anything around healthcare for childcare. And so this is a first step. And hopefully, frankly, the healthcare arena will maybe change and this will be helped, and it won't have to be only for childcare providers, but, you know, until then. And so there's a bunch of steps that, again, we know we need to continue to work on so that work is not done. And I love, Jim, that you're talking about the value of childcare providers. I mean, I think people certainly understood that more during COVID, but certainly not enough. I know I was, you know, with teachers not being in the classroom and having amazing benefits and better pay, and childcare being open without healthcare, without pay, and without great pay. That was, you know, that was really frustrating. And being able to, you know, have people love their childcare provider in their community as much as they love their teacher in their community is kind of a goal that I see as important too. So I think that's also anything the community can do to, you know, do an ad, thank you childcare providers, you know, do a billboard, not only go into this field, but thank you. You know, it does go a long way, I know.
Yeah, if I could tag on with that, I just want to put maybe a little plug in for our local burgeoning, growing Childcare Alliance that has been gathering and brewing over the last 6 months, and now coming into some form. And I think our main goal is to be sure that we're talking together and understanding where our needs are and how to access the resources that are coming through our state channels and then maybe nationally. And we're really, right now we have a survey that's going out all over the county looking at need, But what we do understand as a community from some state research that came out of Commerce, and just from looking at models around childcare utilization across the country and across our state, that we really have about 350 to 450, depending on what model you use. We have need that is not met. We have about 1,050 licensed childcare slots, but it's looking like we need about 1,400 slots. So I think we have a lot of work to do here locally to understand how to expand, who's expanding, where is it happening, and are there unique sub communities within our community that need and that want childcare that is trauma informed, that may be dual language, and those kinds of more organizing kinds of ways of coming together as a community. One thing that we are doing that I want to get on everybody's calendar is in collaboration with a number of people like Prevention Works and other groups, we are putting together a childcare job fair on July 31st. Save the date. Where we hope to invite lots of childcare providers to talk with people about careers in all kinds of childcare across the age span. So put that on your calendar, watch for that. But these are the kinds of things we hope to see more of, because we're truly a kind of impressive group of people who want to, in each of their ways, address the growing needs and the growing awareness. So
Lynn,
thank you so much for illuminating.
Can I just, that just reminded me of two quick things, if I might also mention. Colleen, when you talked about building, I did want to mention that we also passed House Bill 1331, which basically said that impact fees for childcare cannot be higher than for office or retail use, because what we saw is that the way it's calculated, that building childcare can actually be a pretty high impact fee. So we said that it can't be any higher than retail or office, and a community can waive those fees. So just like they do for low-income housing or affordable housing, it's actually encouraged that a community waive the impact fee altogether. So that could help on the construction side. So I did want to mention that. And then the other thing, and maybe at the fair, I don't know if you guys have a local diaper bank, but definitely one of the things that we put in $5 million this year to provide to diaper banks to ensure that that low-income families could afford diapers, could access diapers. And so, you know, for childcare providers who, you know, a lot of childcare providers sometimes require a parent to bring in diapers. So there might be some good synergy there to either have the childcare be able to access that diaper bank, or to have them share with their families that they can access diapers at a diaper bank. But they're going to be able to buy 29 million diapers across the state, and that's, you know, for any young family, we know that's a huge cost and a huge need.
So Lynn, if I may, I would love to hear from Mary and Wendy and Linda and Steve, some of the, and also Christy, how many current kids do you provide childcare services to, and do you have room for expansion?
Well, I'll start off. I mean, we have limitations now just due to COVID. And so we're at 45, and we could go to about 80 without restrictions, and we're full. And so, yeah, we've got limitations there still, but hopefully those will be getting reduced here shortly.
Right, June 30th, right? Hopefully.
Yeah.
Yeah.
We are pulling kids off our wait list in our brand new Port Angeles club that we opened up on the 5th of March. So Rep sends state money for that to help get that beautiful facility underway. We're serving, yesterday there were 100 kids there. And of those 100 kids, 10% were foster. So I want to encourage you please to do some kind of set aside or some support for foster youth. And we're talking under 12 years of age. Just got an email last night that getting 2 more up there this week. So we have tried to put foster youth to the top of the list as they are cycling in and out. In our swim club this morning, I'm so surprised no one burst into this meeting because you're sitting in a running clubhouse. We are also slightly over 100. We have room by the end of the month. As we're segueing also into summer, the 16th in Port Angeles and the 17th in Sequim. We will be doing also the food sites at 15 locations in Port Angeles, free summer meals to all children 18 and under, and 5 in Sequim in conjunction with school districts too, doing the meal bags. But we have room for about 75 to 100 more, and we are pulling them off our wait list. So I'm very excited to be able to offer these services to our children in the summer, because more and more parents are coming out of unemployment and looking desperately. You were right, Kristen, when you said we have a broken market. We have a very high demand and a very low supply. So that was really an interesting term you used to kick off this morning. But Wendy, my partner over at the YMCA.
Thanks,
turn.
Mary. Yeah, we're serving 60 kids in licensed childcare in the Port Angeles School District right now. Once we approach summer, we will split. We'll do a combination of licensed childcare at Dry Creek Elementary and then licensed exempt care out of our Port Angeles YMCA branch. So we are seeing, just even since March, our numbers have continued to climb in terms of the number of kids in care. And we're anticipating a really robust summer. And I just want to acknowledge Representative Sen. This has been the single greatest investment in childcare in Washington state history. And I think it does acknowledge the critical economic infrastructure of childcare. And I also want to shout out, Jim, your comments are so great in terms of lifting up our childcare staff. And I think it would mean a lot for childcare staff to have a community acknowledgement of how important they are. They're also heroes. They are also essential workers. And I think we've talked quite a bit about a community of support, acknowledging this as a profession. And I think it is going to take all of us doing that. It's not just the Y as an employer, Boys and Girls Club, or Shore Aquatic Center, or Sunshine and Rainbows. It's the entire community acknowledging how critical childcare is. So, but again, Representative Sen, thank you for all of your work on behalf of kids. I keep thinking about the kids, and the families are right at the center, and it's just our job to do everything we can to support them. So thank you for all of your work.
Thank you. And Mary, I'll get back to you with specific supports for foster youth, because I know there was a bunch of other things swirling around, that was not necessarily part of this bill for foster youth. And so I'll put together a little summary for you and see if there's specific things on that. The other thing I would just say, Amy Anderson from Association of Washington Businesses was unbelievably supportive and a huge advocate. And so if there are, so like Jennifer, if you haven't spoken with Amy, or if there is a collaboration of businesses that want to be doing something, Amy Anderson is definitely somebody also to talk with. I know we're talking with the Port of Seattle and the airport, SeaTac, and Amy to talk about what we could do around childcare near the airport, to bringing not just airport workers, but like the hotels and other people together to talk about childcare. So I would definitely, again, if you guys have a coalition or collaboration there, it might be worth talking to Amy too. And
this is Linda Middleton, and Sunshine and Rainbows is at full capacity. We don't have any open slots we increased our capacity a couple months ago and immediately filled it all. We are also gearing up for the summer food program in conjunction with the school. But in the summer, we're going to have all the after-school kids full-time. I don't know how it's going to work. So we're scrambling.
Yeah.
Thank you for everybody's for their service. And I mean, everybody's exhausted from COVID, and then the summer comes, and who's going to be even more busier? Those people who've been open the whole time. You guys, it's going to get even busier. So truly hats off. There is one component for any, I don't know if probably Sunshine and Rainbows, you might be a center, not a family home, it sounds like, but for a family home who has physical space, like so if you're in a big home or you've got lots of room, we also did expand that you can have more than 12 kids. So that was a policy change there to help address capacity. So you still have to have the ratios and, the code standards and safety things. But if you do have the capacity, it used to be just, sorry, didn't matter, only 12 kids. And now that we remove that. And so you can talk to the department if you think that you can handle more capacity.
Great. That's really good news. I'm aware of the time. It's 9:04, and we typically wrap it up by 9, and then people have a little time to talk with Colleen if they would like. So let me just take the time to, again, thank you so much, Representative Sen, for being with us today and for the for the love that you have shown for childcare, providers. And I have no doubts that you have other things going on in there that we will have yet to see happen. And thank you for that too. Thanks to everyone on the call for the great questions, the interest, and the things bubbling up inside of you about childcare.
Mm-hmm. Thank you so much, Lynn. Thank you so much, Colleen, for inviting me. And it's so great to see so many of you and putting names to faces and faces to names, and happy to join anytime.
Thank you. Thanks so much.
Bye-bye.
Enjoy the day, everyone.